Your doctor sat you down and said the words, "I'm afraid you've got stage C heart failure." Your mind tries in vain to process these words, but it can't. But what you really want to know is, what does this mean for me now and in my future? And how worried should I be, really? And in the next few minutes, we are going to answer those questions. So, meet Michael. Michael is a pretty typical case of this kind of thing happening. Michael's a 62-year-old engineer. He's married, he's got kids, he's got grandkids, and he spends a lot of time at his desk. He's a little overweight. He doesn't do as much exercise as he'd like to, and he carries a lot of stress in his job. Between that and his family, life is pretty busy. And recently he noticed that it seems to be harder to climb the stairs at his office. He's slower and a bit more fatigued on inclines and has to stop occasionally to catch his breath. He thinks he's gained a little bit of weight over the last few weeks, a couple of kilos or so, but he doesn't think that he's been eating more than usual. And he just passes this off as getting older, being less fit, and just generally not doing so well. Maybe it's stress even. Then he starts to notice that his feet aren't fitting into his shoes so well. He heard of people's feet spreading as they age. Maybe that's it. But then his ankles start to swell, and he noticed his legs didn't fit into his trousers so well. His wife even commented on his legs thickening up. And his wife makes him go to see the doctor. He has some basic tests, and then the doctor said those words, "You have heart failure. It's stage C." Michael is stunned. He has no words. He has questions, but no questions. He's overwhelmed, his mind's spinning, and to be honest, he's quite shocked by this news. He thought everything was fine. He got given a pamphlet and a script of some medicines to get from the pharmacy, but he felt scared, not that he was going to admit that to his wife or his family. He thinks to himself, what does this mean? And what do I do now? So for starters, many people are first diagnosed when they hit stage C. We are going to run through what these stages are and how to recognize where Michael sits. It sounds scary, I get it, like a cancer diagnosis and cancer staging. But let's break this down and work through what it really means. Stage A. This is really when the heart failure is a statistical risk. You don't actually have it yet, but you have the makings of it potentially. There are no symptoms or signs and no failure that we can detect on testing of your heart function, but there's an opportunity for prevention. So stage A, what kind of person might fall into this risk category? The kind of things are high blood pressure or hypertension, type 2 diabetes, artery disease in your heart, blockages, family history of heart failure, history of alcohol misuse, obesity, smoking, mild kidney damage. What could you do at this stage? Well, one of the most important things is to try and assess whether or not you have any of those risks and then work on them, like control your blood pressure, aim for a blood pressure less than 130 on 80, manage your blood sugar diligently. If you have been told that you are pre-diabetic, work really hard, whether it's with a dietitian or your doctor or other healthcare personnel, to lose some weight, get more active, and change your diet. Exercise most days, even a walk counts. Cut back on salt and processed foods that have high amounts of sugar and salt in them. Stop smoking if you're a smoker. It's genuinely not too late. Tell your doctor about all your risks and deal with them together. So, stage B. This is the silent beginnings of heart failure. You feel fine, but when we look at your heart, there are issues. We see things like thickening of the heart muscle. A thick heart muscle becomes stiffer and doesn't relax so well when the heart chambers are trying to fill up with the blood to push out to the rest of the body. A silent heart attack could have left a scar. This might show up as thinning of the heart muscle, and it behaves as a floppy structure or something that doesn't contract and squeeze well. This makes the pumping of blood from the chamber sluggish and inefficient. Special heart ultrasound can help us see these things and accurately assess them. The ultrasound also lets us measure things. This includes EF, or ejection fraction. Think of this like a stroke volume of an engine. Each time the engine turns over, it pumps out power to the car. And in this case, the heart chambers are pumping out blood to the rest of the body. There's a fraction of blood that's pushed forward. That fraction isn't 100%, just due to the system being a vacuum and that being too hard work. But when it's pumping efficiently, it's sending out about half to 2/3 of the blood in the chamber. That's 55 to 65% or thereabouts. That's what we talk about as being very normal. So don't get scared when you hear 55% and think, oh, it should be 100. It's not. So at say 40 to 54%, this is reduced, although not severely. More significant is less than 40%, with under 30% being quite severe. Stage B, though, is your second chance, and it's an opportunity to get treatment and change some lifestyle factors if needed to prevent you from getting to stage C. So let's talk about that. If we are to summarize the heart's efficiency, ask some questions. Establish what is your ejection fraction on ultrasound. Is it changing? If not, is it likely to change? Then ask, am I on the right medications for my condition? And ask what else might need to be done to treat this condition. You don't need to memorize the numbers. Just know what this means for you. So stage C. Here's where our engineer Michael is sitting. He has this stage C heart failure. So what does that look like for him? Well, whilst it could look like any of these types of issues listed here, you will recall that there was a drift in his exercise tolerance, trouble going upstairs and inclines, more fatigue when walking, and the development of some swelling in his feet, ankles, and then calves. This was alongside a noticeable jump in weight of 2 or 3 kilos, nothing tremendous, and this was despite him not really changing his diet. And all of this prompted a visit to the doctor to assess why this was happening. He got a few tests, which included a blood test, an electrocardiograph, which looks at the electrical signal, takes about 2 or 3 minutes, and a special heart ultrasound takes about 30 minutes, called an echocardiogram. And this is what led his doctor to telling him he has stage C heart failure. But if you're hearing, seeing, or reading about classes of heart failure, this is something a bit different. This is what we use to talk about how bad someone's limited by their symptoms of heart failure. And that looks like this chart over here. I'll walk you through the classes, class 1 to class 4. So basically class 1 is no limits, symptoms only at extreme effort despite some impairment in your heart function. Class 2 is slight limitation. It's usually things like feeling breathless, walking on faster on the flat or up an incline or going upstairs. Class 3 is a marked limitation with symptoms with light activities. This might be showering, it might be dressing, it might be hanging out washing overhead, it might be doing light activity. Any walking on the flat might make you a little uncomfortable. And class 4 is actually quite serious. It's symptoms at rest. So you can't do anything comfortably. You can't talk without having to take extra breaths mid-sentence like this. You can't get the whole thing out in one go. You might find that you can't eat without having to stop and take some breaths and then keep chewing. You are possibly feeling short of breath just sitting doing nothing or lying down flat, or you wake up in the middle of the night short of breath. You have to prop yourself up on 3 or 4 pillows or even sit upright in a chair. These are serious symptoms of heart failure. So ask your doctor, what class am I, if you've been diagnosed with heart failure? And it tells you how hard you're working, your heart is working for you right now. So stage D. Okay, this sounds serious, and actually it is. But try not to think of this as end of the road. For those just coming to terms with this, try and think of it as the beginning of your understanding and a journey towards the best health that you can achieve with a team that supports you all the way. In this stage, breathlessness and fluid retention persist despite maximum recommended medications. You might have been experiencing serious hospitalisation in the coronary care unit or even the intensive care unit, or perhaps it's been a recurrent hospital admission. You get sick, you spend a couple of weeks in hospital, you get some treatment, you feel a bit better, not a lot better, and then you go home only to bounce back in another week or two. And this pattern might happen a few times. Frequent admissions to hospital are a pretty significant warning signal, and it is likely that treatment needs to be escalated. And this might include things like special heart devices or even special consideration of what we call an implantable mechanical pump or LVAD, or even considering a heart transplantation. So when all options have been exhausted, sometimes a special service that concentrates on comfort care might be introduced to help you. This service is called palliative care, and their purpose is to manage symptoms when cure is not possible. The whole goal is to try and make life more comfortable for you so that you aren't suffering. So if you're here at stage D, then make sure you ask for a referral to a heart failure specialist if you're not already seeing one, and maybe even at a centre that has these higher capabilities for care. They're usually tertiary, big public hospitals that offer services at a very high level, including transplantation. You deserve expert care. So if we go back to Michael, our engineer, before he got to understand what stage C was, he was inconsistent with any medication, he was missing doses, he was not sure if it really mattered, and wondered why he was on what seemed like many medications when previously he wasn't taking any at all, no pills, and he was scared, and so he was avoiding his doctor because he didn't really want to hear more bad news. He would delay or postpone an appointment that he was supposed to have and put it off and put it off. And after hearing his diagnosis, he was naturally scared about exerting himself. And he didn't know what was safe to do, so he stopped walking. And he didn't do any moderate physical activity at all because he was afraid he might overdo it. And so he was just starting to avoid part of his life, including even seeing his friends. He didn't know what to say about it. He didn't know what his EF of 38% meant, but he was sure it sounded really bad. And he felt alone and scared and lost and just confused about what he was supposed to do. But once he had taken some time to learn the information we presented here, he felt a bit more confident about his situation. He took his medications properly as instructed because he understood their importance and how they can really change his future. He stuck to a daily routine that had him track his weight and look for early signs of fluid retention so that he could stay well and keep out of hospital. And he walked regularly each morning with his wife, and he kept up his appointments with his doctors and his health team. He went and saw an exercise physiologist and a physio and got some help with guidelines about how to exercise well. And he knows his EF. He knows his ejection fraction and his class and what symptoms and signs to report to his doctor early. And he knows to speak up early and not just wait until his next appointment. God, I wish more patients knew that. So he knows if things aren't tracking well. He feels like he's now back in the driver's seat again, rather than being taken for a ride he didn't ask for. He feels empowered and a partner in his own care, and that's what we want our patients to feel like. That's what we want to give them. So, here we are to summarize what we've learned from Michael so far. No matter what your stage is, these 5 things matter. 1, ask what stage A, B, C, or D am I? Number 2, if you've had an echocardiogram, know what your EF number is, your ejection fraction. This is like the stroke volume in the engine. And 3, each day, start your routine by weighing yourself, record it, look for any sign that you have suddenly gained weight. If you have gained more than 2 kilograms in a couple of days, then you must notify your doctor or your nurse about this. And 4, take your medications consistently and as prescribed. Your medication can transform your future health. Move every day, get some guidance on what exercise is safe to do in your condition, but even 15 minutes of activity can help. This all impacts your heart health. Knowledge is your first prescription. You are not a bystander in your health. You are the most important person on your care team, and nobody will care for you more than you care for yourself. So advocate for yourself, get informed, and I cannot urge you enough to do this. Be part of your care. Be part of driving it. And that really starts with educating yourself so that you can feel empowered to get your best help and your best heart health possible. And it makes such a big difference. It's something I see all the time in hospital and in clinics. So the final message is this: know your stages, because this will give you the confidence to make active decisions in your own care and put you in the driver's seat to get everything that you need. And I hope that this helps you, and I wish you all the best health from the bottom of my heart to yours.